We sound checked this with nobody in this room, and now there's a whole bunch of people in this room, and it'll be hard to get everybody's attention. But we want to start with our programming today, just so we can lay out the concept of our building. I can give you a little bit more volume, but I don't want to blare out the people in the front. Can the people in the back hear me okay? You guys are good? Okay. Well, guys, I appreciate everybody being here. Obviously, it's a bigger group than what we anticipated, but that's a blessed thing to have happen to you, right? Is that there's more people interested in what you're doing than what you anticipated. So we'll take the blessing today, and we're thankful for it. So I want to thank Memorial Heights Baptist Church for organizing all the food for us. They did a great job, and all the residents at the mission who've hooked all this up. So guys, we're here for the groundbreaking for the Union Rescue Mission, and you are sitting in the men's dorm at this point. This will be the men's dorm hopefully next year at this time in September when we do groundbreaking. All the men are going to be sleeping in this part of the building. So we appreciate you. Some of the stuff that we know is some factual information. Right now, from this point of the building back is as much space as we have in our current facility. And so if you take that, that's only a quarter of the building that we have, that we're in. We're going to be able to do a lot more things. Some things that you can anticipate for the new Union Rescue Mission is the fact that we're going to go from 62 beds to 150 beds. We're going to be able to have men, women, and children. We're also going to be able to have a STEP program, which we're going to talk about here in a minute. But not only that, we're going to be able to provide a library, a career center, a medical room, other things like coping skills such as a music room, art room, things along those lines as well. That's all upstairs, which we're not talking about today. We're only talking about the bottom floor today. But anyway, guys, I want to get into the programming because I want to respect your time. I said we'd do this over lunch, and we're going to try to hold to that and be done by 1 o'clock. So let me get through some of this stuff, guys. A couple things I need to say special thanks to. Thank God for us being here today, right? This has been a huge battle, right? Since 2018, we've been working to get to this day. And today, we're just thankful to be this far. And we kind of set up our Ebenezer stone, right? And say, thus far, the Lord's been with us and has been faithful. And we believe that so far. We're here today because of his faithfulness. Next, I'd like to thank the Mayor and City Council. We have been back and forth and toured buildings and had meetings and battled people and celebrated with people. And we've done all different types of things together. But the Mayor and City Council has been pivotal in making this happen today. Kevin Thacker, I don't think he's here, but he's answered a lot of random phone calls from me about this building. So I appreciate him. Jeremy Irons is probably my go-to for any question I have regarding nails or screws or any other building part we have, and he always answers me. So I appreciate Jeremy's friendship and ultimately his service to the community. Craig Pancake is helping us with funding, and Craig has been instrumental from First United Bank and Trust, has been instrumental in helping us attempt to procure a $1 million grant from Federal Home Loan Bank. They sponsored us. First United sponsored us. And so we will find out in December whether we are eligible for that. But we've made it through 3 of the 4 phases so far to get that grant. So we are happy to be there. Jim Linder from First Peoples, they came on board with us and signed up just to be a partner with us so that we could get more points for that grant. And we appreciate their effort to jump on board with us. All the churches, countless churches here today. This is the mission field of our community. And all the churches in this town understand that. And just like you would build an orphanage in Africa, we do it right here in our town. And this is the Matthew 25 ministry for this city. And we thank all the churches that support us. And obviously private donors. If it wasn't for the $50 donor, we would die. So we appreciate you guys. Our mission statement is pretty simple. The mission statement of the Union Rescue Mission is to decrease homelessness by providing shelter, food, basic necessities, and rehabilitation to those living in poverty in the tri-state area with a commitment to the transforming hope found in the gospel of Jesus Christ. We don't back down. We don't shy away from it. And we've never hid it in any public meeting we've ever been in, who we are and what we represent. Right? And we represent a greater kingdom than us. Our motto in our buildings are excellent in heart, excellent in deed, and excellent in Jesus' name. And that's what our staff try to represent when we're working with the homeless population. And we understand we're not working for us. but we're working for Christ in our work. So most of you know of the Matthew 25 ministry that the Union Rescue Mission is, right? Matthew 25, 35 through 40 says, "For I was hungry and you gave me something to eat. I was thirsty, you gave me something to drink. I was a stranger, you invited me in. Naked and you clothed me. I was sick and you visited me. I was in prison and you came to me." The righteous will answer, "Lord, when did we see you hungry and feed you, or thirsty and give you something to eat? When did we see you a stranger and invite you in, or naked and clothe you? When did we see you sick or in prison and come to you?" The king will answer and say to them, "Truly I say to you, to the extent you did it to one of these brothers of mine, even the least of them, you did it for me." That's the fabric of community. Without a community desiring to take care of the least of these, you have no community at all. If you're not willing to sacrifice yourself to make sure the most vulnerable in your town have the basic necessities, you really have no community at all. That's the foundations of community, is the bottom up, right? We got to keep the bottom up with us. So everybody's used to hearing that from the Union Rescue Mission, but some other things that we stand by that are biblical teachings that you don't hear a lot about. 2 Thessalonians 3:10, "If anyone is not willing to work, he shouldn't eat either." Right? We believe that to the core. That's why the guys at the Union Rescue Mission, anybody using our shelter space has to work. They got to work around our building. They got to get a job in the community, but there's no one riding for free, right? They all got to help because we're a community and we're a family. Another saying we have around the mission from Galatians 6:7 is, "Don't be deceived. God is not mocked. For whatever a man sows, this he will also reap," right? I always tell them, if I put a tomato plant in the ground today, a seed in the ground, I'm not going to get a corn stalk 6 months from now, right? Because I'm going to reap what I put in the ground. That's exactly the way it is with this. If you're going to sow drama, you're going to get drama back, right? If you're going to sow laziness, you're going to get poverty. But if you sow good things, if you put good things in the ground, God multiplies those things and good things start happening. So those are all mottos and scriptures we use for the Union Rescue Mission, not just Matthew 25. So our team, we have a great board of directors. We have Bruce Irons as our president, Dixie Pownell as our secretary, Grover Doling treasurer, Harold Fike, Craig Hartsock, Dr. Diana Nyland, Kim Smith, David Wagerman, Dr. Tim Thorne, Paul Nightingale, and Donna Dayton represent our board of directors that help make decisions for what we do here. We have a great staff. Obviously, my wife, she's a great staff member to have on board as the assistant director. Amanda Preston is our female case manager. Josh Alt is the male case manager. Timothy Roy is development coordinator. Shane Lancaster, male participant manager. Tracy Hockenberry is the female participant manager. Frank Redmond, dietary. Mike Andrich, dietary. And Mark Engel helps with maintenance, especially of this building. And there's a quote from one of the people who used to live with us, named Brittany. She says, "You will never really know how thankful and grateful I am for you guys. All of you believed in me when I didn't believe in myself, and I will forever be grateful, Brittany." Brittany had lost up to 4 kids to foster care because of her drug addiction, but now is doing well, working, has a job, has a car, taking care of her child that she has now, and doing great things. And so what we're here today to do is we're here to change the nature of the Union Rescue Mission, right? The mission stays the same, helping people in the name of Jesus, providing hope in the name of Jesus. But what we realized over time was just giving people shelter and food was not effective in nature. We had to give a comprehensive program that dealt with multiple different facets of a person's need. So we came up with this program called Pathways to Hope. And we call it Life Recovery Program of the Union Rescue Mission. So it's not an addictions recovery program, but it's a life recovery program. It's a program to try to help these guys get back on their feet and get stabilized. This Pathways to Hope program operates off of a therapeutic community model, and it'll be utilized in which all participants, staff, community members commit time, energy, resources to provide an environment of growth. That means everybody. That means our community partners. That means our churches. That means our staff. And that means the residents all come together to push each other up, right? And it's the therapeutic community model that we're shooting for at this new facility. Union Rescue Mission Steps to Recovery. If you want to know how our program operates, this is how there's going to be different phases. You can come here in a very low barrier type of entry in our overnight shelter space. And that will be open 24 days, all night, 365 days a year instead of just cold weather. That will be open up every night for overnight shelter guests, but it's night by night, first come, first serve, much like you think of a homeless shelter. The next part of our program is called the discovery phase. The discovery phase of part of the program is they don't want to be in the overnight shelter, but they don't know if they want to commit to the program yet. So we give them time to just kind of be part of the program without committing to it for 30 to 90 days. The first step of the program is called life recovery, and it's 90 to 180 days. The second step is, the second phase is next step, 30 to 90 days. And the final phase is phase 3, graduation, is 365 days long, part of our program. You see different quotes from Nikki. She says, "The mission made me realize I'm not alone on my journey, and they helped me greatly with starting my career as a CNA. While at the URM, I was able to find my way to God." Anthony, a 51-year atheist, "I believe the Lord brought me to the mission to meet him and be saved." You have Gail down here at the bottom says, "The staff has shown me that they truly care and love the residents here. They love seeing people succeed. They didn't just bring me in here for a hot and a cot. They truly worked with me, took time out for me, told me and showed me that I am worthy and deserve a good life." From Gail. So how do you start this process at the Union Rescue Mission? That's the question, right? Well, the first thing that you would do when you come into our facility using any part of our program is we enter you into a system called Mission Tracker. You see the logo there. Mission Tracker works with the national HUD computer system. It cooperates with them, and they get locked into a database for us so that we can track their progress wherever they're at. So they would log into Mission Tracker. We get them uploaded into Mission Tracker, and that would also help us share data with other organizations and raise some money using the stats we would get from that. But the next thing here, this is the unique thing about the mission, right? Most people are used to having entry-level stuff. You got to fill some paperwork out and come in. But this is something unique to the Union Rescue Mission. The Union Rescue Mission, walking through different organizations, touring different organizations, we got help establishing this matrix called the AIRS matrix, right? And the reason it's called AIRS is it's if you look at the left-hand column, it's right there: housing, employment, income, recovery, and spiritual formation. Each one of these categories are scored 1 to 10 for each one of those categories. So, for example, somebody in recovery right here, they would be saying, detox required, they would score a 1. But if they came over here and they are serving as a sponsor in other recovery programs, they would score a 10. So somewhere in that category they would fall. What this AIRS matrix does is it allows us to score these guys out, and you can see on the bottom of the page the score range they have, whether they're in crisis, whether they're vulnerable, whether they're stable, whether they're safe or thriving. What stats have shown us with poverty is until people get to this category, they will not succeed in not coming back into homeless. They will come back to homelessness until we can get them to the safe and stable area, because they haven't learned the coping skills in each necessary part of life to accomplish what they need. So this matrix is done with them as soon as they walk in our door. We do this matrix to find out where they're at and what are they scoring. From there, like we said, the residents or the program participants can come in, and for 30 to 90 days, they can just test the program out. What they're going to do in that time is they're going to be able to stay with us. They're going to be able to stay overnight. They don't have to fight for a bed every night in the overnight shelter space. They get their meals. They get to participate in all the program activities, including 20 hours of work. They got to do 20 hours of work for us around the mission to participate in things that we have going on, whether it's security, we have inside maintenance, outside maintenance, we have dietary, and we have driving. All those are jobs we feel like people can get when they get out and they start looking for jobs. They're entry-level jobs that we think people can achieve. The pre-program discovery phase, this phase allows the opportunity for participants to work through basic issues regarding recovery while discovering whether or not they desire to be in a longer-term treatment program. Each participant identifies and supports additional supports he or she may need in their relationships, employment, spiritual formation, education, while having access to food, shelter, basic case management. Those seeking emergency overnight shelter without a desire to enter the program fully can do so by utilizing this pre-program discovery. So if they think, hey, I just need a couple nights and then I'm going to be good, then they would enter this part. Now, our case managers take that matrix. If we flip back, if I go back up one, and if you see how it's broke down into section, housing, employment, income, recovery, spiritual formations, we will tell you how we do our treatment planning. The treatment planning first, the first phase in the recovery, we're working on your physical health, making sure you got a primary care physician. We're making sure you're connected with insurance, because if you have diabetes and your diabetes is out of control, we can't go much further than that, because you're not going to succeed in a job because you're going to be in the hospital. We work on your mental health. If your mental health is unstable and we can't get you connected to a physician to help, there's no point in getting you into a job because it's going to bomb, right? And finally, addictions. If you're active in recovery, there's no point in sending you to a job because it's not going to work out. So that's what our case managers start working on first, is what recovery items need to be. If people have an addiction past, addiction history, it's automatically for the first 60 days, they have to do 5 NA, AA meetings or Celebrate Recovery meetings a week. They have to do 5 a week to be part of our program. They just have to, and we will transport them there if they need a ride. The next part of our programming that you'll see is once they get done the recovery part, we will look at employment factors. What type of education barriers are there? Do they need a GED? Are they looking to get a CDL license? And then we work with Western Maryland Consortium to plug them in to use the grant money available for them at Western Maryland Consortium to get all the way through college education if they need to get them back up on their feet. After that, we start saying, hey, we need to get a job. It's time to work. It's time for you to start making a living for yourself. All the while, we're working on spiritual formation and life skills. However, at the end of it, we're going to make sure that they have a full understanding of everything we've taught them in light of the gospel and other life skills they may need towards the end. And finally, the final thing we look for is housing. Now, I know this is countercultural because the culture tells us it should be housing first option. That has failed miserably. We've been doing that in the state of Maryland for a long time. And what happens is we keep seeing the same people come back into homelessness over and over and over again. Why? It's because we don't have the other situations cared for first. So we're going completely off the grid here as far as what our culture tells us we should be doing, because we believe that if we can get the core things that a person needs, these types of things situated, stabilized, that they'll be successful and not come back to homelessness. Because our goal is not to perpetuate homelessness, just to kick it down the road for 6 months so they come back into homelessness. Our job is to end homelessness, right? That's our goal. Not to just say, well, you have a home for 3 months and you didn't pay your rent, now you're back. That's not what we're here for. So we want to invest in these things. The next part of our program is life recovery. The biggest thing with life recovery is now they're required 40 hours of work, a week of work on recovery things. So their NA meetings count, their AA meetings count, their doctor's appointments count, their medical appointments count. All those things count. Any education they're getting counts for those hours. And then whatever hours they have left at the end of the week, they work for us. So if they got 20 hours of work scheduled because they're going to doctor's appointments, NA meetings, AA meetings, and they come back to us and they're like, hey, I got 20 hours left this week, then we schedule them for 20 hours of work around the mission. All for job skills and job training. But they have a different level of access now. They're going to get case management services. Things like their driver's ed's going to be paid for. Their driver's license are paid for. Birth certificates are paid for. Social security cards are paid for. All these types of things are where we start investing our money into these people once they get to this phase of the program. And so once they get here, we start investing in the bigger things in life that these guys may need. Like I said, all the way up through, if we had to get them into college or GED classes, we'll help them get into those things as well. This part of the program lasts 90 to 180 days. They can live with us and work through this. If they need longer to get through a education program, we'd be glad to let them stay as long as they need, as long as they're making progress. The next phase is the next step. This is guys who've completed all their education. If you remember those arrows we talked about, they're stable in their recovery. They're stable in all their education. They now have a job with income. They would move into the next step phase. These are guys working every day. They haven't started paying rent or anything yet. They are just working every day, grinding it out every day, and maybe catching up on back fines, back child support, things they need to stabilize and get settled before they get out on their own. So they have 30 to 90 days that they can make money and live in our program, and that can be extended as well if necessary. Most of the time by this point, the guys are like, okay, I'm ready to go now. But if they need longer, we keep them longer. And finally, the last phase is the graduation phase. This graduation phase is a year long where we just send a text out randomly just saying, hey, how you doing? Checking in on you. And if they desire to get their peer mentoring type classes or peer recovery type classes, we would help them get established with that so that they can come back and help our guys. And mentor our guys back in the program because they had lived through it once. They get to now help people that are going through the program. So what do we need to be successful? Well, we need a building. That's the whole push, right? The whole push is for this building is because we can't pull this program off successfully in our current location with as small as it is. To do this, we need to have more bed space so that we can keep people longer. Right now, we try to get people out of our program 60 to 90 days is what it's been. That's failed miserably since 1963. It's been successful in providing shelter and food. It's not been great at rehabilitating people to make them successful, right? So what we have to do is we got to have a bigger program, a bigger facility. That's what we're working on. That's why we're in this building today. So you guys have seen the pictures. They're all around. It's the same pictures that we have all around. Our family, women's and children's dorm, that's one room here up on the top. That's like the mom and the children's bedroom. Then they have like a little living room area. And then down the bottom is like a bigger family for a bigger family if they need it. So our financial need. The building project total is $4.4 million. We'll just say $4.4 million. So we'll just leave it there. We won't get into all the cents. We've purchased the building and we now own this building and we are, that was $1.2 million that we've purchased the building and we sit here today. We have a little bit already in development costs as far as getting the designs completed, getting permitting completed, things along those lines. So we're further down the line than that at this point. However, our construction budget is slated to be $2.8 million. Okay, that's where we're at. That's what we need from this day forward for people to be staying in this shelter space and people to be successfully competing in life, right? $2.8 million. We also have, you kind of see the whole breakdown here, right? We have some equity in our buildings, which we already know. We have 13% already pledged or donated. We have a potential grant of $1 million that we're eligible for that we hope to get. And so we have a construction loan making up 25%. And we have a funding gap of 8.8%. Is our funding gap. So to break the numbers down is we need to raise about $1.5 million right now to get here. To do that, we need all the community support, obviously. And that sounds like a big number, right? $1.5 million, but we have an impact area of 1.3 million people as the range of people we impact. There's no homeless shelter from Morgantown to Hagerstown, right? And we're it. We get people from Moorfield, Petersburg, all the way up into Somerset, Breezewood, that whole area. We have people from that need help, and we impact that area. But so if you start taking that, you start thinking, okay, well, you need to raise $1.5 million. How are you going to do it? 15,000 people giving $100 ends this whole thing for us. Right? I mean, that ends this whole thing. If we have 15,000 people in our community and the areas out of 1.3 million people that we impact, if 15,000 people say, I will give $100, this whole thing's over, we're packed up and we're building and it's all done. Right? That's all it takes. It sounds like a big number, but when you start breaking it down, it's really not that big of a number when you start saying, I'll do my part. Right? I'll do my part. Somebody else can do their part. And then before you know it, we raise the money. How does this become a reality? Well, you can pray. Obviously, for the mission, we want you to pray every day. If you want to know where the battle line of good and evil is, it's at the door of the rescue mission, right? There's light and darkness all hitting at the same spot all the time. And we're in the war every day. And so pray for us. Give. Generously invest. This is legacy giving here. Somebody in 1963 thought it was a good vision for our community to have a homeless shelter. Our community has ate and feasted off of that vision from 1963. We have a vision now that's going to carry for generations to come here in this community. And you would be investing in generational giving. Your gift lasts. A gift that was given to the mission in 1963 is still impacting our community. The gift given today, 60 years from now, will still be impacting our community because you help establish these walls. Encourage friends to support. Everybody knows somebody, and the most valuable person that we have to fundraise with is the person that's already giving. Because if you trust us with your money, your friends will trust you. So encourage your friends to give. And you can also consider giving to the mission through stocks. We can accept stocks if you want to offset I know some people have their mandatory deductions they got to take every year. We can accept those types of things as well. And then we can cash them in. And there's a whole bunch of tax benefits for you to do that, which I won't get into because I'll butcher it. But a lot of tax benefits. We got people that handle that. So if you are interested in giving stocks, let me know because we can tell you all the tax advantages to doing that. So guys, we purchased the building in December 14th of 2022. And our goal is to have groundbreaking next September. Next September, we hope to be coming back here a year from now and doing a ribbon cutting with all you guys and celebrating this monumental victory for the kingdom that has happened. So that's kind of our timeline. You guys can see that all break down. All this stuff that I'm sharing today is in those packets that we had out at the front table. So feel free to take them if you desire. And at this point, I wanted to open up to any questions that you guys may have about the program. But that's our program, guys, and that's the heart of why we're doing and pushing so hard. Because we believe that giving that wraparound help, that comprehensive help, is what's going to help people have hope. Not just giving them a bed and food, but giving them comprehensive services.